Hi, and welcome to the Cannabis Show. I'm Chris, and today we have a doctor in the house, Dr. Stephanie Mason. How are you?
I'm very well, thanks. How are you?
Oh, I'm doing well. Now, you've been with Natural Health Services pretty much from the get-go, but tell us, what exactly is your role with Natural Health Services?
I am the medical director of Natural Health Services, which means that I oversee the clinical staff and make sure that we're doing everything we can to deliver compassionate, competent care.
Oh, that's excellent. Now, what's your background, Dr. Mason?
I'm a physician, and I was a psychiatrist for 30 years. And I decided to do a shift in my career at a certain point when I became a bit disillusioned with Big Pharma and some of the ways that people were being managed medically. I think we had to sweep with a broader brush.
And so why was it medicinal cannabis then? You just knew, or you had an inkling, or?
It was a very strange series of coincidences. I have a big interest in addiction, and the problem that I ran into with that was we got no traction in terms of funding or getting help to sort of build a facility for people that struggled. And shortly after that sort of fell apart, I met Steve, our business partner, and he was interested in getting a clinic up and running, and I thought, why not? So that was in May 2015, and since then it has shown me the way, I guess, because we've been able to do harm reduction for people with substance use problems, but it's so much bigger than that. And, sorry.
No, it's cool. So where you've been, like, from 2015 and where we are now in
Yes.
2017, what would you say is like the biggest challenge from a doctor's standpoint when it comes to medicinal cannabis?
I think the biggest challenge is the pushback from other physicians, the government, the College of Physicians and Surgeons, and the lack of willingness to learn. That's been by far the greatest frustration for me.
So I guess it's still a fight out there then.
Oh, yeah.
Eh? Yeah. And why do you think there is a backlash? Are people just being naive, or?
Well, I can tell you that 3 years ago I would have probably been in the other camp because I didn't know enough about medical marijuana to be sort of fair about it. And I wouldn't fill medical marijuana prescriptions for my patients. But the more I learned, the more I realized that the medications that I had been prescribing for 30 years were causing harm. And so it was time for me to take a second look at what I was doing.
Okay, well, so that's the background. Let's just move a little forward. Now, when patients do come in to you and say hi, what's pretty much the most popular ailment that they're coming in for?
I thought about that question, and I think the biggest ailment is suffering, both physical and psychological. From a physical perspective, it's pain and pain management, and from a psychological perspective, it's anxiety, depression, insomnia, and the stress of our world that is really hard on people.
And do you find that the medicinal cannabis is helping?
Very much.
Yeah. Again, speaking with Dr. Stephanie Mason, a doctor with Natural Health Services, you see it all the time on social media, and this is so popular, cannabis, cancer.
Yeah.
And I know there's hundreds of different types of cancers, and there's many different types of cannabis as well, but what can you tell us about that? Does it help directly, or?
Well, there's been what we call outliers. We've seen patients that have gone into remission unexpectedly after stopping chemo and going on to cannabis as palliative care. These are unusual situations, but they're baffling to both the physicians and happily for the patient. So does it cure cancer? I don't know. Can it potentially reduce the rate of growth of a tumor? I think so. And can it actually cause the tumor to be destroyed? Possibly. Yeah. There aren't enough studies to confirm that it is an anti-cancer drug per se, but it really helps with the side effects of chemotherapy and the pain and nausea and appetite. So it's been huge in terms of reducing the chemicals that those patients have to take.
Yeah, that's exactly that's what kind of answer I wanted to find there. Now, you said more studies. Like, how much more studying needs to be, or money needs to be put into medicinal cannabis?
I'm not sure. I think that where I sort of stepped away from the medical profession was reading the evidence-based medicine that really wasn't evidence-based. It was funded by drug companies. The data was not what I was seeing clinically. And so I became very disillusioned with that. So one of the things I can say with certainty is the absence of things that have been discovered about cannabis is highly significant in that it doesn't kill people, it doesn't cause liver toxicity, it doesn't cause domestic disputes, it doesn't cause kidney failure. Whereas a lot of the medication that I've been prescribing has a lot of secondary, very negative side effects.
Yeah, no, it does get pretty scary out there. What about with children and cannabis? You know, you hear, like, I got friends that, you know, their children have seizures and
Yeah.
stuff, and how are we seeing that improve?
Well,
Or is it?
again, it becomes a matter of harm reduction, because I see kids with seizures who are on very addicting, very high potency anticonvulsants, and their pediatricians are not open to cannabis. So the way we got into this was a mom came in who had bought illegal cannabis oil for her son who was having seizures and was getting some improvement. So we offered to treat him with the traditional Charlotte's Web that has been known to help kids with seizures. And he went down to 0 seizures.
Really?
Yeah. And it was amazing. So the other area of childhood treatment lies in cerebral palsy, spasticity, myoclonic seizures, ADD. Because again, the stimulants that we're using on kids have huge side effects and potentially long-term downsides.
Where would you like to see medicinal cannabis go from here?
I would love to be able to establish a harm reduction program for people with addiction. We've seen many, many patients come off opiates spontaneously without even a formal program. I would like to see cannabis used as a first line for pain. I would like to see cannabis used as a first line for epilepsy in kids. Where do I see it going? It's almost too big to look at, but I can tell you that it's been the best part of my career.
Are the doctors getting trained on this at all now in college or universities?
No. So what we've got upstairs in the clinical team is a group of people who are dedicated to learning about cannabis, and I've got a wonderful team working with me who all know a lot about the different strains, how they affect different parts of the body, and how to direct patients to use them, and they've been amazing. So we're all learning together about this.
Excellent.
Yeah.
Now, Dr. Mason, what would you say? I mean, you've already said a couple like little stories in there too, but what's just one of your like favorite standout stories so far of medicinal cannabis?
I think one of them is a man and wife actually who came in just after we opened, and he had stage 4 throat cancer, and she was heavily addicted to opiates. We offered him cannabis to help him eat with his nausea and pain. And I saw them a year later, and he was in total remission.
Oh,
he was
wow.
one of the miracles. Yeah, it was amazing.
Oh, that's excellent.
It was amazing.
So how long ago was that?
That was, I saw him in November, December.
Okay.
And I met him for the first time a year before that. And then his wife was off all her narcotics.
Wow.
So.
And are there plenty of those type of stories to go around?
Yep, absolutely.
Excellent. Now, Dr. Mason, before you go, and thank you for taking the time with us on our show, the Cannabis Show, what is one thing you would like a first-time patient to Natural Health Services, what was there one thing you'd like them to know?
What I want them to know is that we're here to help and to deliver compassionate care. What's happened in our system is that we've grown so quickly that patients are getting frustrated by the wait times and by, just being sort of thwarted by the sheer numbers. And we want people to understand that we're doing our best to set an excellent standard of care and that we care about them. So I guess that would be the number one thing, is that we want people to feel better after they leave.
Dr. Stephanie Mason, thank you so
My
much
pleasure.
for today. That is awesome. Thank
Thanks.
you very much. That is Dr. Stephanie Mason of Natural Health Services. And who knows, maybe we'll have a question for her or for us. You can always tweet your question to @NatHealthServe, or you can ask us a question at the Cannabis Show at naturalhealthservices.ca.